Another key issue is the funding of a universal healthcare system, which has raised issues around possible tax adjustments, as well as the relevance of the private medical aid industry in the country. Profmed CEO Craig Comrie joins us now to expand on this discussion. Thank you so much for your time, Craig. Let's start with the initial reaction. It is now in motion. It's a law. What is it that you are going to take as a next move and preparing for the eventuality?
Well, we have been in consultations for over a decade regarding the NHI Bill. It is a pity that not much has changed, and despite the consultations, there hasn't been much heard in terms of alternative proposals on how to accomplish universal health care where you don't have to infringe on the rights of choice of either using a medical scheme or private health care, but having to be solely reliant on the NHI as contained in the bill. So, like most laws, I think it has to still be tested against the constitutional items that we will certainly raise and challenge, and then continue to consult and hopefully mold the reforms, because healthcare needs reforms, whether it is the public or the private sector, but try and work together to find the right solution for all of South Africa.
Talking about alternatives, where does the NHI in its current form not tick the right boxes for the private medical aid industry?
Well, effectively, what it does is it relegates, in the long term and probably in many years to come, it really relegates medical schemes to only cover what is termed complementary benefits. And those benefits are those that are not provided within the NHI benefit package. And so in the bill, it's called the NHI Comprehensive Benefit Package. And so it's a far smaller role to play. Now, it is unfortunate because we believe you can actually achieve universal health care coverage quicker if you focus your spend on those who are most vulnerable and allow people to spend their after-tax money in a space where they could utilize healthcare services elsewhere. But there has to be a closer collaboration between the public sector and the private sector. In fact, what we should see is more centers of excellence where both the private sector can use public facilities and vice versa in terms of developing the best and certainly an improved healthcare system going forward.
Lastly, based on that, what then is Profmed's stance with regards to other bodies seeking to litigate?
Well, we form part of an industry association which has a plan to do exactly that, to litigate. But as we litigate, we're suggesting an alternative that would work. And so we're hoping that either the courts or the High Court will listen to those suggestions and that we can come together and maybe reform the current NHI Act.
Thank you so much for your contribution. That's Profmed CEO Craig Comrie talking to us in our continued reaction to the signing into law of the National Health Insurance.